Good afternoon. I want to begin today by again thanking our partners in media for your patience, for your willingness to ask questions, and for your desire to spread the news across our community for this very difficult situation that we are now in. I want to begin also by indicating again, as I announced this morning, that we unfortunately have had to confirm our second death from COVID-related causes here in Monroe County. This occurred yesterday in an individual who was admitted to the hospital at Unity in the ICU. We've been following this individual's clinical course for some time now, and I want to take a moment to express our sympathy for this individual's family and friends. As you will soon learn, we are now up to 81 firm cases here in Monroe County. Currently, 12 are hospitalized and 5 still in the intensive care unit. These results, as you know, are coming out now every day, twice a day, at 10 o'clock in the morning and at 4 p.m. In the evening. Going forward, we are also going to report on the number of tests that we receive. Now, to clarify, these are test results that we receive, both positive and negative, but they do not, the statistic does not include the number of tests that have been collected, but yet have not yet been processed. So as of today, we have received 1,340 test results, again, 81 of which are positive, and these represent those for whom we manage here in Monroe County, so this does not include residents of other counties. With that said, I want to talk a little bit about where we are in this response. A lot of questions around testing, which is appropriate. As we've discussed, the capacity for testing is still not where we would like it to be. If I had our way, we would test far more individuals than we currently are. And the consequence of that, of course, is that we are now underreporting the total number of cases here in the county. That being said, I also want to shift the conversation away from the number of tests that we have and the number of confirmed cases we have, again, because that is also an underreport, and start shifting the conversation to the number of individuals who are hospitalized and those who are in the ICU. Because as we look ahead, trying to forecast how this will shape up here in our county, we're paying very close attention to how the number of hospitalizations and the number of ICU admissions is faring relative to our capacity as a community, particularly with respect to our hospital systems. As you've heard, the goal of our approach is to flatten the curve. We want to have as few cases as possible. We want the increase, the surge, to happen later if we can avoid the surge at all. And finally, we want that surge to be short. We don't want to have a huge surge taxing our healthcare systems all at once. We want to essentially pace ourselves so that we can remain under that total hospital capacity that we have in the community while we work to expand that capacity going forward. So that is the approach right now with regard to trying to get ourselves through this epidemic. With that, I'll turn it over for questions. I understand there are many questions. Actually, I'll address one now. Questions around the idea of having an interactive map. I am fully in support of having a map that highlights where the individuals live in our county, but I'll tell you I have reservations about that. One is that if you happen to live in a zip code or area where there is not a reported case, I don't want you to leave with a false sense of security, thinking that somehow you might be more able to go outside and defy the stay in home orders that we've implemented, because that is simply not true. And second of all, I don't want those who live in an area where there are cases to feel falsely alarmed, because frankly, the risk across our community is quite consistent. We know that this is widely prevalent in our community, and I don't want any particular zip code or neighborhood to think that they are more or less at risk than the next. So we are working on how to make that map useful for people. But again, my reservation about that is not that we don't share the data. I think the data are important to share. I just don't want people to come away with a false sense of alarm or a false sense of security. So with that, I will take questions.
Okay, thank you, Dr. Mendoza. And this is Julie Phillip. I'm Monroe County Communications Director. And I want to thank, first of all, Mayor Lovely Warren and her team for allowing us to use this facility today to answer questions from the media And we're going to start with Patty Singer from Minority Reporter. Patty, you have a question and a follow-up.
Does there be, when does it become the point where we can test for that epidemiology to see how many people may have already been exposed to it, and we get a better sense of where it is in the community? At what point can we, again, looking forward to that, to see whether this curve is going to flatten or maybe has flattened?
So to repeat your question so that I understand, your question is, at what point might we be able to test the actual prevalence of this infection in our community? The current test that we have available is a PCR test. It's a test that looks for the DNA, or in this case, the RNA, of a virus in an individual's body. We are still learning a lot about this infection, and our belief at this time is that once an individual clears the infection, their PCR test will become negative. And so in theory, if somebody were to be infected today and were to clear their symptoms, make full recovery, at some point in the future, if we were to test them, given our current technology, their test would come back negative. In fact, some of the criteria that have been proposed to clear people from isolation rely on the presence of negative test results following a positive. So in answer to your question, it's very difficult to know, given the current testing. Now, in the future, our hope is that we'll have an antibody test that will act in many ways like the measles or the mumps antibodies, where once it's positive, in theory, it should always be positive, indicating that you've had a prior infection or a vaccine, which we don't yet have for this. So at this time, we don't have a way of measuring the point prevalence of this illness in any community.
Go ahead, Patty.
Quick follow-up. So if I'm tested, I meet the criteria, I'm tested today, I test negative, that doesn't mean I'm not going to end up testing positive the next day. So we're still catching people at a moment in time, potentially a false negative?
That is correct. And that's the reason behind the guidance that we've had all along, which is that we do not want to test people who are asymptomatic, because the feeling is that there's a high false negative rate among people who are negative.
Okay, thank you, Patty. Next question is from Jennifer Lukey from WHEC.
Are they seeing?
Jennifer, can you start over? The audio was, thank you.
Sure. I'm wondering, Dr. Mendoza, of the 81 people who have tested positive for COVID-19 here in our community, what have their symptoms been like? Have any of them recovered, do you feel like, from the illness and are back in the community?
So the issue of recovery is that we've been trying to grapple with, because many of these people were really not that sick in the first place. They had mild symptoms, again, 80% of people. And if you look at our numbers to date, roughly 80% of those who are positive did not need at least hospital level care. So our belief is that what's holding true across the country is also true here, that really only 20% of the individuals who are infected end up needing hospital level care, have moderate or severe symptoms. So to date, we have not cleared anybody from isolation, because it's been too soon since the beginning of this to have met all the criteria for clearance. Just this morning, there are a couple of individuals who we were able to detect relatively late in their illness because they were travel related, who now meet criteria for clearance. But that really is as of this morning only, so I haven't had the final word on that. But the vast majority of people that we're visiting are feeling relatively well in their homes, isolated, doing what we've asked them to do. And really the people who are ill are the ones who are in the hospital. And those are the people that we really need to focus on.
Do you have a follow-up, Jennifer?
Yes, please. And Dr. Mendoza, obviously with these 81 folks, last week you told us there was a shortage in the testing, so only healthcare workers, first responders, and those already in the hospital were being tested for it. Is that shortage letting up at all? I mean, the state and the governor and the president both said, if there's a shortage of materials, we'll try to get them where they're needed. Is it better here now?
Hard to say. I will add, first of all, to the criteria that we introduced last week with prioritizing hospitalized individuals and first responders and healthcare workers. In the health department, I also have the ability to prioritize people that we want to test from an epidemiologic standpoint. So if we believe that they are a close contact of a known case and that will change our approach to that particular family, if there's nursing home involvement, either from a staff or a resident standpoint, there are additional exceptions. And to date, using these unfortunately more narrow criteria for testing, there has not yet been any sign that we've not been able to test anybody who we've needed to test using those narrower criteria. But this is a day-to-day, week-to-week sort of thing. And, we're looking ahead as best we can. I know the U of R lab is looking at that reagent that we talked about last week, and they will need more, certainly. If they don't get more from their supply chain or from the state or federal assets, they will run out of capacity, there's no doubt. So that is something that we're working very, very closely with them to try to preserve.
Okay, thank you. The next question comes from Steve Orr at the Democrat and Chronicle. Steve?
Thank you, Julie. Dr. Mendoza, I wanted to ask about nursing homes. There are 4 in Monroe County where there have been COVID cases, 2 in nearby counties, at least one of which may be related to Monroe. What can you say about those nursing homes and the situation there, if there have been any additional cases in those homes, and if any of those COVID cases are related to each other or stem from a common source?
So thanks for your question. What I have as far as data are that 2 of our confirmed cases reside in nursing homes. I am also aware of one of our hospitalized patients having come from a nursing home. Now, I don't have in front of me which ones they came from. We are doing contact tracing, and it does not appear that those cases, these 3 individuals, for example, are related to one another. We are investigating as well among our confirmed cases, healthcare workers, visiting nurses, individuals who provide home health care. That line of work is much more difficult to trace. We have an individual who has visited multiple nursing homes, and so that is certainly something we're looking into. But it's really hard to find a smoking gun, as it were, because of the variability in which people present with symptoms. So to Jennifer's point earlier, typically it's fever, cough, shortness of breath, but we also know that among our older individuals who've been confirmed, they haven't read the recipe, as it were, and they present in some cases with atypical symptoms. Some have not had a fever, although the vast majority have. So those are the things we have to look at more closely, but we are looking very closely because, with contact tracing, our ability to fully contact trace every individual, we have over 400 people in quarantine right now. We're prioritizing the more high-risk settings, healthcare workers, nursing homes, first responders, and so forth, because that's where we really want to contain this. Because for the vast majority of the rest of the public, we consider it to be widespread.
So if I could ask a follow-up quickly. 3 of the patients in nursing homes are rehab patients and just arrived there recently, just before they were diagnosed, coming from presumably hospitals or other settings such as that. Can you say none of those are related to each other? They're not all coming from the same hospital, for instance?
That has not been my understanding in looking at the data. No, they seem to be isolated cases.
Thank you, Steve. Our next question comes from Tanner Jubinville from 13 WHAM. Tanner? Hold on a second. We're working on the audio.
Yes, I'm here now. Thank you.
Okay, great.
I wanted to ask you, I know we talked about contact tracing last week, and do you envision hitting the point soon where it will just be too cumbersome to really effectively trace every patient?
I'd be lying to you if I didn't say that we were getting close to that already. And so late last week, we're looking into technology that will allow us to continue to trace people once we've made that initial contact, because the contact tracing part is really only the first step. If we can trace them, but we can't follow through with that, then there's just really no point to doing the contact tracing. So we're able to do the contact tracing right now, but the issue really is in the quarantining and the isolations, following through with all those individuals on a daily basis with phone calls and visits for the vast majority of them. We're looking into ways to be able to achieve those goals using technology, using FaceTime, using apps, and so forth. So we've had discussions in the last several days about how we can slowly transition into that line of work so that the contact tracing that we do will continue to be adding value to containing the epidemic. But it is a lot of work to visit and call 500 people a day. And we want to continue to do that, but we want to make sure it's manageable going forward because, quite frankly, we all think that the number's only going to go up for now.
And a follow-up question, I'm talking about PPE shortages. We've gotten a lot of calls and emails in the last week from people claiming to be working in emergency departments, emergency rooms, and hospitals, saying that they're having to reuse. There's a lot of issues with the PPE shortage right now. Have you heard this to be the case? And when do you think this could change if there is in fact a really, really bad shortage at the moment?
I think this is an example of where it's important to verify and validate. The University of Rochester over the last I believe made available to all of their staff the ability to get one surgical mask per day if they so choose. And the result of that is that nobody's taken them up on it. And so I guess the question really is, how do you reconcile the offer and the result? I think the perception is certainly out there. And having just gotten off a call with both the hospital systems in the last hour, there's no doubt they are working to conserve their resources. But at this time, they are able to meet the needs as best as I can tell. But I would defer that question to the hospitals. We are working with them to ensure the sustainability of their supply chain. But as of today, they are able to meet their needs.
Thank you, Tanner. Atia Collins from Channel 8.
Hi. As far as it goes with equipment, what number of cases? Hi, can you hear me?
I just want to make sure we got the beginning of you were a little chopped off. I want to make sure we got the beginning of your question.
No problem. I'll start over.
Thank you.
As far as it goes with equipment, what number of cases are we able to address with the equipment that we have currently?
So right now we're focusing on beds because that I think is the hardest resource to develop. Between both hospital systems, they're looking at available capacity. As you know, we've been able to reduce through a lot of hard work on the part of both hospital systems to reduce the number of elective cases. They've been able to make space in their hospitals. So the first point of meeting a demand, a surge demand, would be in the walls of our hospitals right now. They are not at capacity at the moment, and that's intentional because we're bracing ourselves for a surge in demand. Then we're looking at other sites. So, for example, apart from a typical hospital room, if we're not doing elective operative cases, then the recovery rooms, the post-operative rooms are available. Those are also accessible within the hospital, much more easily utilized for surge capacity. Then the next would be looking at the outpatient surgical centers and other outpatient settings and other places where there may be beds and space and all of that available. And the challenge is really in staffing and particularly in some settings, equipment. So we're looking at settings like that. So we're slowly trying to ramp up, and the hope is that we can ramp up this capacity so that we have it ready to deploy in advance of when we need to actually use it. At a balance, of course, we don't want to deploy it too soon because that's not wise, but we want to have it well in place in advance of any time we were to need it. But staffing is really going to be the main challenge. We can get equipment from the state. We have assets available to us here in the county. There are ways to make equipment available in a setting like this. But the real demand is going to be the personnel, the people who will be managing these individuals. And if we can keep them out of acute settings, our ability to utilize our workforce will go all that much further. So in an ICU setting, the number of patients a nurse, for example, can safely manage is far less than if they were in a regular floor. And so to the extent that we can prevent the need for intensive level care, i.e. try to keep people healthy, then our nursing and all of our assets will be able to go a lot further.
Perfect. I don't have any follow-up questions. Thank you, Dr. Mendoza.
Thank you, Natia. Next question is from Brett Dahlberg from WXXI News.
Hey, Dr. Mendoza, can you hear this?
Yes, I can, Brett.
Perfect. All right. What's Monroe County doing to prepare more hospital beds, more ICUs, more isolation rooms, and what's the timeline for making those facilities available?
Well, again, and just in the last hour, the county executive hosted a call with both hospital systems, with the state Department of Health, with representatives from the governor's office, and we're making that ask literally as we speak. We're asking each hospital system to develop a plan that outlines the number of beds that would be available, sort of in concentricals, if you will. What number of beds would be available in X number of time. How many more beds and resources can you add if you add in another week after that, and so forth. So we have the ability to predict going forward the number of resources that we'll be able to have as a community. So as far as timeline goes, we're still working on that. But certainly we want to have that in place as soon as possible, because the sooner we can plan, obviously, the more well prepared we'll be.
Thanks. And what about the workforce? What about the ability of healthcare workers to stay healthy and to be available to work in those facilities?
Well, again, I'd be lying to you if I didn't say that that was a major concern on all of our minds. As healthcare workers, we want to stay healthy. As the Commissioner of Health, I will tell you the workforce in healthcare is the most important workforce right now, and we need to prepare and help keep that workforce healthy and strong, because we want to be able to be prepared, which is why my advice is even greater for healthcare workers. If you are sick, please do not go to work. I understand that the hospitals want you back as soon as they can, but that presumes that you're healthy. We do not want people who are unhealthy or people who are unsure to be in the hospitals, because all it takes is one person. And if you've seen a nurse or a doctor working in the hospital, they're touching all sorts of things, and they're in touch with a whole lot of people. The last thing we want is for an individual like that to expose a number of people in that setting, and not least of which the patients themselves. So, my advice to healthcare workers is absolutely do not go to work if you're not feeling well.
Thank you. And our final question is from Spectrum. Andrew Freeman is on the line.
Yes, thank you. Dr. Mendoza, to follow up with what you were just talking about, do we have any idea, are any of the 81 cases right now healthcare workers, first responders? Do we have a number?
Not off the top of my head. I can tell you that under 10 are healthcare workers or in some related field, but it's been relatively small.
Thank you, Dr. Mendoza. My other question is, the more we're learning about this disease, the advice right now is to stay inside. But is there any new information that's coming out that's talking about the viability of how long this virus hangs out in the air or on surfaces? And then to follow up on that, what advice do you have for people that want to walk their dog or take a jog or just get some fresh air, while they're staying inside as much as possible?
So everything I've read to date still confirms that what we've always believed is still true, that this is transmitted by respiratory droplets from a person-to-person setting. And so a lot of this is around making sure that you keep that distance, largely because if you're coughing or sneezing inadvertently, you don't want that respiratory droplet spray to come into contact with another individual. That is, to our knowledge, the most common way this infection is being spread. Now, there's been a lot published really in the last 2 days now about the presence of these viral particles on surfaces. There was one paper I just read in the last hour that showed that depending on the kind of surface, we believe plastic and stainless steel and harder surfaces are able to sustain the virus on that surface for longer. I've seen reports of up to 3 days. So that is something I think that bears attention. On the flip side of that, we also know that this virus is very easily destroyed with good old soap. Because of the way the virus is constructed, the outer lipid layer is destroyed very easily by soap, which means washing your hands with soap and water is still the best way to prevent yourself from getting ill. Sanitizing hard surfaces with any general sanitation disinfectant will work. We do not believe that this is easily transmitted on cardboard, on paper, or on fabric. Everything I've read has said it's very, very unlikely to transmit this through those kinds of porous or fabric type surfaces. So really the concern about the virus living on surfaces is going to be on metal objects, plastic objects, doorknobs, handrails, elevator buttons, and things of that sort. So what I would say is if washing those areas down at least once a day, if not more than that, I think that's a very appropriate precaution. A lot of questions around, whether it's safe to take, take out food and packages on your doorstep. Again, the most common way of transmission is person to person. So if you can maintain that 6-foot distance or more, that is the most important precaution that you can take. Before eating, it's always good to wash your hands. If you're cleaning produce, for example, washing the produce as you normally would be a very appropriate precaution. But I think we need to, again, think through the facts and use a little bit of common sense. And we'll post more of this guidance on our county website at monroecounty.gov, as well as on the local Twitter feeds for the Monroe County Health Department.
Okay, thank you, Dr. Mendoza. That ends the questions. I want to once again thank the mayor and her team for allowing us to use this facility today to answer your questions. Do you have any final words, Dr. Mendoza, before we let you get back to work?
No, again, I just want to thank our partners in the media. I think your work now is harder than it ever has been. I think your role in the community is more important now than ever. I want to encourage you to keep asking me questions. I will do the best I can to answer them either through Julie or through our Twitter feed. I think information is the most important thing that we can share with our community. And again, I want to thank you all for your patience as we work through this tough situation together.
Okay. Thank you, and thank you, everybody.